Hello friends, hope you are all okay, you are all enjoying your life, you are all enjoying practicing ultrasound. Welcome back to ultrasound teaching videos with Dr. Arshad Nadeem Awan. Today my topic of discussion is secretion within the uterus and secretion within the vaginal cavity. So there are a few terminologies we use. One is called as hydrometria and another is called as hydrometrocolpos or haematometrocolpos. Whenever there is secretions or fluid within the uterus, that would be termed as metro. And whenever there is a fluid or secretion within the vagina, that is called as a colpos. So we are going to discuss about hydrometrocolpos and haematometrocolpos. If before the puberty, fluid or secretions are collected within the uterus or within the vagina, that would be called as hydrometrocolpos, because there is no bleeding. That's before the puberty. If you come across certain evidence on the ultrasound imaging, so that would be termed as hydrometrocolpos. But after the menstruation, after the puberty, if you see some fluid within the uterine cavity or within the vaginal cavity, so that would be considered as haematometrocolpos. So these two are the terminologies. You have to be very careful when you are writing that on your report, and on the grounds of imaging, ultrasound imaging. So you have to be very clear whether it is hydrometrocolpos or it is haematometrocolpos. There are certain reasons for the hydrometrocolpos and haematometrocolpos. This could be acquired and this could be congenital. In congenitally, it could have been imperforated septums or vaginal septum, imperforated hymen, or some other congenital or Mullerian duct abnormalities. But so far acquired are concerned, this could likely be due to cervical stenosis, cervical cancer, endometrial cancer. So you have to be very careful for the causes and ask the patient's relevant inquiry, and then look for the diagnosis. On the ultrasound imaging, if it is a hydrometria, so then there will be clear fluid. And as I mentioned, hydrometria is usually before the puberty. There will be no internal echoes and it would be a pure fluid secretion. But in haematometris, you will see low level internal echoes will be there. And again, you have to look whether it is in the uterine cavity or it is in the vaginal cavity. So then you have to distinguish this. In case of fluid, there will be a fluid level, low level internal echoes, there will be debris. So you have to categorize whether it is a haematometrocolpos or it is haematometria. Yeah. So therefore you have to be very careful. If in case, the third terminology which you can apply here is if there is fluid particularly distending cervical canal. There is no distension in the endometrial cavity, there is no distension in the vaginal cavity, but only cervix is distended, that you have to mention, you have to use the term haematotrochloea. So I'm sure now you will be able to understand on the ultrasound imaging what the haematometria is, what the hydrometria is, what the haematotrochloea is. So these three are very distinct, easily understandable terminologies. You need just to pay attention. Beside this, on diagnosis on the ultrasound imaging, you have to be very careful, first of all, for the location, second, for the amount of the fluid, and the third, for the characteristic of fluid, whether it is clear fluid like some other secretions, or maybe mucosal secretions, or these are, or it is hemorrhagic, or it's blood. So therefore you have to be very careful for diagnosing all these things. In postmenopausal ladies, if you come across any fluid, you must must raise suspicion for the cancer and the malignancy because of the age. So if there is fluid within the endometrial cavity, you may suspect there may be some cancerous process going on. But in majority of the cases, as far as the literature is concerned, it shows that small fluid within the endometrial cavity in postmenopausal women, if they are asymptomatic, it happens to be normal. On transvaginal scan, if you see small fluid within the endometrial cavity, so that would be considered as normal. There will be no major abnormalities. But if it is large in size, large in amount, so therefore you may look for other malignant potentials as well. So in postmenopausal female, the one thing is very important: you have to look for the endometrial thickening, and the second thing is you look for the fluid within the endometrial cavity. If you come across any endometrial fluid and the patient is asymptomatic, so mention it on the report, but this is likely non-cancerous or benign in nature, could have been due to any stenosis, cervical stenosis, or any other non-malignant pathology. But if it is grossly distended endometrial cavity or grossly fluid, you can appreciate on the ultrasound imaging, so must look for the malignant potential. So how we will appreciate all these on the ultrasound imaging, how these images will look like, whether these are a hydrometrocolpos or haematometrocolpos, or these are haematotrochloea. So these are all the information I have put in these next slides. Start watching these slides, and I do hope that this will really help to enhance your diagnosis.
On this transvaginal scan, a large complex cystic lesion can be seen. This is actually haematocolpos. The patient she's a young patient and with imperforated hymen, showing that the vagina is distended with the blood and collection of blood within it. On this ultrasonic image, you can see low level internal echoes within this cystic lesion. This is actually haematocolpos. What the best strategy would be, you have to take the measurement of this, take the volume, that much amount of blood is retained within the vaginal cavity because of whatever that is a clinical diagnosis. So you should have to just mention over whatever you have seen on the ultrasound images. So this is actually a cystic lesion which is in actual blood and retained blood within the vaginal cavity, and it will look on the ultrasound imaging like this. So patient history revealed that she has an imperforated hymen, and that was haematocolpos. This is the same patient, but only transabdominal scan has done. Here you can see distended bladder, uterus is clearly visible because on the transabdominal images you can see all the area, a broadened view can be seen. So that's why under the transabdominal scan you can see that the uterus is clearly visible, endometrial cavity is clearly visible, but down to the cervical region, which is the area of the vaginal canal. So vaginal canal is distended with low level internal echoes. This is characteristic of blood on the ultrasound imaging. So this is actually blood. So what you need to do is mention that uterus is okay, endometrial cavity is clearly visible, cervical canal is fine, but down to the cervical canal, within the vaginal canal, a large cystic area can be seen with low level internal echoes. Give the measurement. It is better to give the volume. So the volume is maybe 10 ml or 20 ml or whatever the volume is. Mention the volume on the report, and in the conclusion mention that the ultrasound features are suggestive of haematocolpos. And in the differential, you are well aware that because of any of the obstruction, especially because of the imperforated hymen, this haematocolpos may occur in young females. Again, the same patient with a better understanding, with the best resolution, transvaginal scan. On this transvaginal scan, you can clearly see a large complex cystic lesion. You should not confuse this with adnexal cyst because you have to perform both. Therefore, it is a recommended strategy whenever you are doing pelvis scan, go for the transabdominal scan to have a broader view, and if there is any pathology suspected, so then go for the transvaginal scan, and then after transvaginal scan it would be clarified. So as you know, this patient was been through all these two scanning procedures. Transabdominal was done, which was clear, uterus was already identified and vaginal canal was identified, and this lesion was within the vaginal canal. So this is actually haematocolpos. Again, what would be the strategy? You mention the characteristic of this lesion. It is a round, it is a complex with low level internal echoes, and it is within the vaginal canal, and most likely diagnosis is haematocolpos. So refer the patient to the gynae department for further clinical correlation, and there is nothing more to advise except a referral to the gynae department. This is the next pattern. This is transabdominal scan because you can see the urinary bladder. This patient having cervical stenosis. Because of the cervical stenosis, the fluid was retained within the endometrial cavity. Uterus is visible. Myometrial thickening can be seen on the both sides, superior part, inferior part, but endometrial cavity is markedly distended because of this complex fluid within it. In the fluid you can see the low level internal echo swirling within it, and the best method is you just press with the probe and you will see these all internal contents will be seen movable. So this is actually blood. Because of the cervical stenosis secondary to cervical carcinoma, this blood cannot comes out of the external canal and internal os and external os and still remain inside. As a result, uterus is getting enlarged, and on the ultrasound images this is what you can see. If this condition is visualized, again the best procedure is mentioned that the uterus is distended with distended endometrial cavity having complex collection within it, low level internal echoes. Always mention the volume of 10 ml, 20 ml, and there is no other pathological processes could be seen. Refer the patients for the gynae, for the clinical imaging, for the clinical investigation, correlate with the clinical findings, and this is what your report should be. So this is clear case of haematometria secondary to cervical carcinoma. So again the same patient, haematometria secondary to cervical stenosis due to cervical carcinoma, was confirmed on transvaginal scan. So transabdominal was performed, and for further explanation and further understanding, TVS was performed. On the TVS, here you can see that the endometrial cavity is markedly distended, is filled with low level internal echoes which is likely blood. Again mentioned that transabdominal and transvaginal scan was done, uterus was distended, and it was filled with low level internal echoes collection, most likely blood, and findings are suggestive of haematometria. So this was the case of haematometria. Many a time, if you have not seen these cases, patients clinician label it as an adnexal complex cyst, which is not true. You have to be very careful whenever you come across any complex cystic lesion. Always look for the surrounding, whether it is within the uterus or it is out of the uterus. These are two important findings. You have to be very careful, and this is what haematometria mentioned on the report. Further clinical correlation is suggested.
Yes, friend, this was all about the distended uterus, distended cervix, and distended vaginal cavity, called as haematometrocolpos, hydrometроcolpos, or haematotrochloea. I do hope that these images will definitely benefit. You will be able to understand on the basis of the images that how you will appreciate all these and how you will write the report and what are the important features you will appreciate on the ultrasound imaging. So there is no more doubt. Hopefully you will be able to understand all these ultrasound features, yes, from these videos. Keep watching my videos, keep sharing my videos with others, and watch and wait until I upload the next video. Till then, take great care of yourself. Bye bye.